Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is brain injury specialist Jennifer Neese. Thank you so much for being here today.
Thank you for having me.
Of course. We're delighted to have you. So we're talking about brain injuries, and you are a brain injury specialist. Tell us about that, Jennifer.
It's an additional certification that you obtain as a professional. You study, you take an exam to obtain that. And by doing that, it gives you additional knowledge in working with those who suffered a brain injury. And when you get the certification, you also agree to obtain 10 continuing education credits per year while you maintain that certificate.
Oh, that's very interesting. Now, accidents, Jennifer, are usually associated with brain injuries, but it's much more than that. How can we avoid these brain injuries?
Yeah, it's definitely much more than that. You're absolutely right. Accidents are kind of the number one thing that we know as brain injuries, but actually there's a much bigger cause of brain injuries that's more medical in nature, and it can be caused by a variety of different things, such as prolonged oxygen after a cardiac arrest, severe infection, aneurysms, or what people know as blood clots in the brain, strokes, seizures, brain tumors and cancers, and also prolonged excessive alcohol use over time can all cause some form of a brain injury that can impact your life greatly.
Wow, Jennifer. Okay, so we want to know, how can we avoid these? What's the best way?
Yeah, I mean, as a young child, we all know wear helmets, wear seatbelts, watch out for concussions and things like that. But some of the other things that we want to be mindful of is, of course, texting and driving with the phones.
Yes.
Nowadays, that's something that we have to be super mindful of. Wearing protective sports gear when it's recommended by coaches and schools. One of the other things that all of these other medical brain injuries really lead to is just leading that healthy lifestyle of exercise, good nutrition, refraining from smoking, of course, alcohol consumption in moderation, and taking medication as prescribed. And the one thing we really teach our patients to know is they know their body the best. So if something doesn't feel right, go get it checked out. That's when you usually can seek medical attention and have a better recovery if you catch these things early.
I love that. If it doesn't feel right, get it checked out. Do not hesitate. That's great advice. Tell us also about your rehab services at Mary Free Bed.
Yeah, it's super exciting here. Every day is a different day, but we provide so many services to patients, physical, occupational, speech therapies. We have a great recreational therapist, and also psychological and social work services to help with that coping and adjustment, which brain injuries can impact the people's life greatly. We not only do that, but we also do community outings with patients that need to get back into the community. We do, return to work things. We do home visits. We try to incorporate if a family member is here suffering from a brain injury and they have a huge life event like a wedding or a graduation, we try to incorporate that into their therapy, whether it's virtual or in person, because this will show them that they can continue to live their life even with a brain injury.
Oh, that's wonderful. And what are some good resources for caretakers, Jennifer?
Yeah, there's lots of resources out there. There's, of course, the Michigan Brain Injury Association of Michigan, which is an amazing chapter. I've been a part of that for many years. They have lots of online resources, not only for the person that suffered the brain injury, but for caregivers of those, which can also be a huge group of people that need support. There's a lot of advocacy opportunities through that organization. There's also the National Brain Injury Association, which does a lot of conferences and sponsors a lot of fundraising events throughout the year. And the American Stroke Association is another resource that's a good one for patients to look up information and just get support. And of course, your local brain injury program, such as our Mary Free Bed at Covenant here. We have lots of staff here who are trained and skilled. We take phone calls all the time that aren't necessarily necessarily our patients, but patients and families in the community that just need some direction on what to do. Maybe they have their loved one home and they don't know who to call, or maybe their loved one suffered a brain injury in Florida and they want them back home, and we help get them back to this area so that they can continue to grow with their family and recover.
Jennifer, I love that because caregivers are so selfless and they need to know that they are not alone. So those resources are very helpful. Tell us also, Jennifer, you know, we can just tell by your demeanor, by your everything that you just love what you do. Why do you love it so much? What's your passion? What's that about?
I just love it. Like I said, every day is a different day. So many patients recover from our program that, I mean, we do a clap out when patients leave, and to hear that every single day, sometimes 5 or 6 times a day, is absolutely amazing. Even on the most challenging days when you just don't know how you're going to get through your day, you have that one patient that says, I'm grateful for what you've done for me. I don't know where I'd be. That's why you keep coming back every single day.
Oh, that's amazing. And we do appreciate you and all that you do in our community. Thank you so much for joining us this morning, Jennifer.
Thank you so much.
Of course, you're welcome. And if you'd like any additional information on today's topic, just head on over to the Hot Links page. That's at WNEM.com.